Hello, everyone. My name is Bree, and welcome to our GLP-1 webinar.
And I'm Dr. Luther, and I'm sure that I know many of you as I see your names popping up, but thank you so much for taking your time to tune in on this Thursday night. And we are very eager to meet with you and found this to be a very fitting way of doing this. And we've pulled together a wonderful team, and I hope that this is very informative for you. As we proceed forward with this, you will have an opportunity, if you have questions that arise, to drop them into the chat box or the Q&A session. And at the end, we'll have an opportunity to answer those questions. There are a very large number of people on tonight. So if there are an equal number of questions, I don't believe that we'll be able to get to all of them, but our promise and commitment will be that we will answer those, and then we'll send that out in an email so that we can address your concerns. But I will go ahead and introduce the panel. And the way we've set this up tonight is by pooling the most common questions that we receive on GLP-1s. And we thought that would be a good place to start. And so you'll hear from a number of us tonight over our experience of treating patients with them, and how those have been working. It's taken us about 10 months to get to this point, and at Symbios, we're dedicated to life behavioral changes that involve nutrition, fitness, correct body movement, but really helping transform our personal habits to enhance our daily living so that we can live life fully. And when GLP-1s became really, really popular, I was very hesitant to get involved with those. And as a result, read a number of adverse effects of these that you'll hear about tonight. And they're definitely medicines that can be very, very effective, but they're also medicines that need to be highly, highly respected. And we really gave this a lot of thought, prayer, time, research, and attention. And we met as a collective group of people. And you're looking at many of us that were on that committee for the last 8 to 10 months. And we put together what I believe has turned out to be one of the safest and potentially most successful and sustainable ways to lose weight. And you'll hear from us what we believe has been collectively the best way to do this and to help you achieve goals if this is a concern for you. So I will go ahead and introduce the panelists, and then you'll start hearing some information. But Celeste Welsh is a board-certified family nurse practitioner, and she transitioned from being an ICU charge nurse, where she witnessed firsthand the devastating impact of progressive metabolic and chronic disease that necessitated life-saving interventions for the most vulnerable patients, to now becoming committed to the early stages of prevention. Her expertise lies in assisting patients in overcoming the challenges of obesity and associated consequences of metabolic disease, empowering them to lead fulfilling and healthy lives. Marilyn Landry is a registered dietitian with a master's degree in nutritional science. Marilyn came to the Low Country from Northern California, where she practiced as an acute care clinical dietitian specializing in therapeutic carbohydrate reduction. Marilyn is trained with the globally recognized Nutrition Network. She's a member of the Society for Metabolic Health Practitioners, and she is a Low Carb USA certified practitioner. Her relentless pursuit of learning and sharing her expertise in this field has solidified her status as one of the world's leading authorities in low-carb nutrition. Melanie is a registered nurse at Symbios Health with over 25 years of nursing experience. She's responsible for performing our body composition assessments using our 3D Staiku diagnostic tool, and she also provides weekly injections for patients who are on GLP-1s and monitors overall progress. Kristianne is a fitness professional with over 25 years of experience working with clients in both personal and group settings. She fully comprehends our need to eliminate unhealthy body fat and maintain and gain lean muscle mass, the tissue of vitality. Her passion lies in empowering women through our Symbios Strong Her program, which focuses on metabolic health, hormonal balance, nutrition, mobility, and strength. However, she is equally qualified to transform men into healthy, fit, and powerful individuals. Debbie is a board-certified family nurse practitioner, also with over 25 years of nursing practice and experience caring for end-stage and critically ill cardiac and metabolic patients. She now specializes in the holistic care and prevention of metabolic disease, as well as women's health and hormonal balance. Victoria, also known as Vika, is our Vice President of Aesthetics and Wellness at Symbios Health, who along with her team is dedicated to ensuring you have the best possible outcome in achieving your goals. And Lindsay is our Symbios Edge coordinator and our personal application expert, and she diligently works hard, scheduling and keeping you on track to ensure that you reach your goals. And John Lippitt is a doctor of physical therapy, certified personal trainer, and competitive triathlete. And he serves as the executive director of our Symbios Edge program, which optimizes the metabolic health and well-being of each member through fitness, nutrition, and proper body mechanics. John leads our weekly Symbios Strong Her and Symbios Edge multidisciplinary meetings for members that participate in our 12-week weight loss programs, meticulously tracking each member's progress. And without further ado, we'll go ahead and get to the questions and hopefully get your answers. Celeste.
Yes, sir. Hi, everybody. So like Dr. Luther says, I am a health coach, primarily for the men doing the Edge RX. So when I go through these questions, these are most of what people have to ask and want to know mostly about. So I'm going to start off with explaining what a GLP-1 stands for. So it is a glucagon-like peptide. It's a natural occurring hormone that's secreted in our gut in response after we eat. So it helps us to stimulate insulin production in the pancreas. It slows gastric emptying, which allows food to stay in your stomach longer. It reduces your appetite, having you increase feelings of fullness. And it also helps to decrease food noise. That's the constant intrusive thoughts about food or when you're going to get your next meal. So there are side effects of this medication, mostly gastrointestinal, so nausea, vomiting, diarrhea, constipation, reflux. Dehydration is another big one, along with muscle mass and bone mineral density. So we'll talk more about that later and how we can help decrease that happening, but that is something that can happen while you're on these medications. So at Symbios, we are really primarily focused on microdosing these medications. And you ask, well, why microdose? Why not get the full amount? There's a couple reasons why. First, it allows a gradual approach of easing the medication into the body. If this is the first time that you've taken these medications, side effects can occur, like I just explained. So minimizing potential side effects are another reason why we do the microdosing. Also for cost saving benefits, these medications can be very expensive. So if we're using a little amount of the medication, the vials are going to last you longer. You're not, dishing out a ton of medication or a ton of money on these medications every single month. And also we have found over 10 months of research into this is that a lot of the times when we give these medications every week, they're compounded on top of the med that was given the previous week. So the last dose builds on top of the previous dose and not necessarily needing to give that full dose. All right, so how long will I have to be on the medication? This depends on your goals, okay? It also depends on your health history and how your body is responding to the medication. These meds are not meant to stand alone. That's why we have a plan here in place that has nutritional support, health coaching, and nutrition to help us with this. Okay, weaning off the medication. This one also is going to look different for everybody depending on their long-term goals. So 2 ways to wean off the medication is by gradually decreasing the reduction of the dosage. We can do these in gradual increments depending on how the patient is doing. Some patients just completely cold turkey go off of it and have no problems, but depending on the patient, we can definitely work with that. Also extending injection intervals. So increasing the time between the doses is really going to help to wean off the medication once you're at your goal weight. What is involved?
Melanie.
All right. So what's involved in an assessment? When someone comes to see me, we always start off by going over a health history. We make sure that their meds are up to date, any allergies they may have, any surgeries they've had, or any kind of limitations that they may have, for instance, in their hips, shoulders, knees, ankles, that type of thing, or their backs that might, interfere with some of the movement once they get to the workout phase. Once we get done with that, I do measure, I get a blood pressure and a heart rate, and then I do get an exact height on them, as close as I can get as a height. We have a little gadget that gets a pretty close height on them. Once we get done with all of that, the client will get on the scanner. When you're on the scanner, you want to be in the most fitted clothing that you have because it measures everything. So you don't want anything loose. It takes about maybe a minute to do the scan, but it'll basically you'll turn around completely in a complete circle, and it'll measure all the different body compositions like fat mass, lean mass, bone mass, visceral fat. There's a whole range of things that it can do. Once we finish up with that, typically I will go from there down and have the client get on either the treadmill or the bike. Usually it's always their choice, whatever they're most comfortable with. I have them work out for about a minute. Once they've warmed up, I have them stop. I check their heart rate. I have them sit for a minute. I check it again, and we're looking for that heart rate recovery. Now, another part of the movement piece is they get put through 4 different movements. They'll do a squat, a push-up, a lunge, and a twist. And they'll also do some resistance movements, which are basically measuring that strength piece, just to kind of see where they're starting from. So we always do one with the first assessment and the last assessment. Once they're done with that, we head back to my room, we get blood work, get the labs that we need. And then I usually sit down and talk to them. Okay, you're going to be talking with a nutritionist. I kind of go over the plan with them. They'll talk with their health coach, the nutritionist, um, um, their trainer, and then they'll come back and see me in 6 weeks, approximately right around in there. And if they're getting ready to start a GLP-1, once it's ordered, then I have them reach out to me as soon as they get their medication, and we get them started on that. When they come in for shots, they're coming in once a week, and they see me. We get those scheduled. I try to schedule everybody ahead. But once we get all that done, I send them out to Lindsay, and Lindsay is amazing at getting everyone scheduled with their health coaches, nutritionists, and the trainer. And then we just follow up from there.
Thanks, Melanie.
Mm-hmm.
All right, Marilyn, does what I eat really matter?
So you're asking a dietitian. So that old calories in, calories out paradigm for weight loss, that is incomplete on its own. So a 200 calorie bag of potato chips and 200 calories of meat aren't the same in terms of nutrient density, hormonal response, or satiety. So I always say count nutrients, not calories. And it's not that calories don't matter, but what tissue is lost matters more. So these medications can suppress your appetite, but nutrition determines whether you lose fat or muscle because foods differ dramatically in how much they stimulate glucose and insulin. So anybody who's talked to me before knows I always say this, prioritize protein foods with the natural fat. Okay, so I think this is really interesting because the low carb diet and with GLP-1 work really well together. So the GLP-1s enhance satiety, and low carb nutrition does the same and controls physiology. So food quality still drives insulin response, but these work really well together. So consider dual acting medication like the tirzepatide. These can improve insulin sensitivity and fat utilization, but really only if carbs aren't excessive. So think of it this way: carbohydrate control should not be considered restriction, it's symptom management. So higher carb loads can worsen nausea, bloating, fatigue, and of course, blood sugar fluctuations. And low carb diets stabilize blood sugar, promote satiety, and allow for lower effective doses of medication. They promote tolerance. I think of the medication as kind of a metabolic support tool as you learn about and transition to the optimal way to eat, which is low carb for metabolic health. So what do we talk about a lot, right? Insulin, right? The hormone insulin. So absolutely what you eat has a direct and powerful effect on your hormones. So food is information. Protein and fat support your satiety hormones like GLP-1, peptide YY, uh, leptin, while stabilizing insulin and blood glucose. So highly refined, those processed carbohydrates, they do the opposite. They spike insulin and drive hunger and cravings. So those carbohydrates actually reinforce your preoccupation with food. So for people using GLP-1 medications, food quality matters even more. If your intake is too low in protein, fat, sodium, or fluids, we can see stress hormones rise, thyroid signaling slows, sex hormones become disrupted, and this is even if weight is dropping. So the goal isn't just eating less, it's eating in a way that keeps your hormones regulated while the medication does its part. Important to note too, when the body senses underfueling, it will adapt by slowing metabolism and altering hormones in both men and women. However, when protein and basic nutrition are prioritized, you can lose fat without triggering those stress responses. That's why intentional nutrition matters, even when hunger is low. So, weight loss works best when your body feels supported, not starved. Okay, so okay, so you know what I'm going to say, right? Inadequate protein, insufficient fat, low hydration, electrolytes. So protein is a big deal. The medication reduces hunger, but it doesn't reduce your body's need for fuel, especially protein. So GLP-1s are sometimes described as fat loss amplifiers, but without adequate protein intake, they also amplify muscle loss. So protein must be intentionally prioritized to preserve that lean mass, your strength, and your overall metabolic health. And then fat, we're still a lot of us in that old mindset, but dietary fat is essential. Hormone synthesis, energy, bile flow, absorption of fat soluble vitamins, ADEK, your cellular integrity, and your gut health. So, chronic low fat intake can actually contribute to constipation, fatigue, dry skin, thinning hair, hormonal symptoms, and gallbladder bile dysfunction. So, fat's not optional, it's required. Another thing, hydration and sodium are really often overlooked. So with lower insulin levels, you have increased urinary loss of water and electrolytes. So sometimes you'll see symptoms like headache, fatigue, constipation, and reduced exercise tolerance that might actually be signs of low sodium or fluids rather than insufficient food intake or medication side effects. So for many people, simply adding some salt to the food, drinking adequate fluids, maybe using some sugar-free electrolyte replacements can make significant difference for them. And the needs for this vary a lot between individuals, particularly in those with salt sensitive conditions, which is why clinical guidance and monitoring are so important. And one thing I just really want to emphasize, absence of hunger does not equal adequate nutrition. Again, intentional eating matters. So prioritize those proteins, the natural fats, to ensure your body receives the essential amino acids and fatty acids it needs to maintain muscle, metabolic health, and long-term function.
Marilyn, while I've got you on real quickly,
Mhm.
a question came in. Is it possible to be a vegetarian and have success on a GLP-1?
So I've not personally had experience with this. I know there are vegetarians that still can do a ketogenic or low carb diet. Definitely can do a low carb diet. You can do a ketogenic diet. It's a little bit more challenging, but I have not had any personal experience with somebody that's a vegetarian on a GLP-1.
From a principled standpoint, if that was their preferred method, what protein sources would you recommend?
Right. So if they're if they consume eggs and dairy and we can do Greek yogurt and they're able to do some of the they would be using a plant-based supplement maybe for protein. We can do it. I think it depends on the person though. It's the kind of sometimes with these the limiting factor can be the protein intake. So we would have to be very strategic. I think it's doable. I just think we'd have to be very strategic in how we're getting that adequate protein in.
Good. All right. Yeah. Thank you. All right, Kristianne, I've not been to the gym in a long time. How can you work with me?
Well, so there's many questions or many answers. Short answer is we will start you exactly where you are. So it doesn't matter if you are a former athlete or if you've never stepped foot in the gym. Based on all the assessments that you have done, we meet you exactly where you are and we design a program, prescribe a program that best suits your needs and your goals. Based on, again, our time that we spend together, the assessments, all the information that I learned from the team. It's really cool in that we discuss you and we talk about you weekly and our weekly meetings. And so you have a team behind you that is supporting you, which I love about this program. Um, and so in that strength training, we also are going to work on mobility, stability, and then, of course, that lean muscle, which is key to basically everything if you're on a GLP. So, as Marilyn said, I could listen to you all night. That was amazing. When you're taking a GLP, as Marilyn said, and as research tells us, unfortunately, one of the side effects is you are going to lose some lean muscle. So there was an acronym that I heard recently, and it's GPS, and it's GLP, protein, and strength training. So the combination of the two are like your magic bullet, especially for women. I think it's just a magic bullet, especially for women that are in the phase of perimenopause and menopause. So I'm going to talk to Strong Her and Edge RX. So it's important for both sexes, but the GPS, as I said, is very important. The GLP, protein, and strength training. And so resistance training is really essentially anything that is a resistance. It can be body weight, it can be strength training. And so we want to preserve that lean muscle. And the only way to do so is by that resistance training. Absolutely. Recent research shows us that you can still build muscle even into your 70s and 80s. Let's not look at numbers per se. Let's just get you into the gym, right? So it doesn't matter if you're 40 or if you're 50. The key here is once you're in your 30s, you're going to start losing that lean muscle. And the only way to get it back is to use resistance, and that is strength training. So it doesn't matter 50, 70, 80, 15. You can still build muscle.
I think that that study that showed, I quote that oftentimes in the office that, even into the 80s, and people say, well, what after that? Well, the population kind of thins out after that. So there's not a huge volume of people to study. But I think the good point there is that, if you combine what Marilyn's saying and get the protein and just like you said, the GPS, and you're doing, you have good body mechanics, you can just keep doing things correctly and then the intensity. But that's why, the personal trainer and having that guidance is so important.
I guess the other aspect to this is that we train very functionally. We want you to be healthy in the gym and then when you leave. So we're going to squat, we're going to reach. We want you to be healthy in your life. And so the movements that we do in our physical training are going to support you in your everyday life.
Well said. Well said. Thank you. Okay, Debbie, how much weight can I lose during this 3-month program?
I get asked this question a lot, and safely, you can lose between 18 and 20 pounds in the first 3-month period. Now, if you have 40, 60 pounds to lose, then we go slowly and we adjust. Some patients do, though, lose more than 20 pounds in that first 3-month period of time. However, we just watch the muscle mass. Everything the ladies have said prior and Dr. Luther said prior, we just continue to watch. So you can lose more, but safely, it's about 18 to 20 pounds during the first 3 months.
What we target is, our strategy, like what Celeste said with the micro dosing, is to find that inflection point. That's why the 12-week commitment is so important. There's a lot of work that's being done at that time, starting at a very low dose to try to target no more than 2 pounds per week in your weight loss journey. And that, serves several purposes. It's a very safe and effective way to do it. It minimizes lean muscle mass loss. But it also, in the end, allows us to help you wean off of it a little bit better. The manufacturers, the drug companies, are now selling these for a lifelong drug. And so, that, doesn't have to be that way if you learn good habits along the way.
How does the GLP-1 interact with my current medications? I get asked that a lot too. And we just look at each individual medication that you're on and test it. And we're going with a very low dose of the GLP-1 to begin with. So we just watch it. Now, I can't say that I've had a lot of patients that have had reactions to it. However, when you're already on, if you're a diabetic and you enter this program and you're on like a glipizide or you're on insulin already, or if you're a younger female on birth control, I just guide people through this and say, we have to watch for hypoglycemic issues because we're introducing another medication that can be used to help correct diabetes or help with diabetes with insulin resistance. So we watch those medications really closely, just like everyone, but those are the ones that can potentially cause the most harm. And then with the birth control, if women are on birth control, the GLP-1 can lower the effects of it. So we have to be careful. And usually in these women, I would recommend like backup protection during intercourse. But we take each patient individually, step by step, and just watch the medications.
There was just a recent study that came out that suggested maybe statins could slow down and reduce the efficacy of a GLP-1. So that too can be something to be watching for.
Do hormones and taking hormones help with the weight loss? If so, how? Oh my goodness. There's some wonderful studies showing that when we introduce hormones for menopausal reasons or other reasons, when we introduce hormones during this weight loss journey, that you can increase your weight loss by 35% with using estrogen, testosterone, progesterone. So that's been a very nice thing that with some of the female patients, we're starting to see those trends go upward and the weight loss come off a little faster. So that's been fun to watch, really fun to watch. Now the Zepbound can target the hormonal pathways and counteract the insulin resistance. So that to explain this, that's one way it can work, because that sugar will waltz into a cell easy as a wink. With all of your cells, sugar just goes right in, but it needs that insulin to go in and convert that sugar to energy. Well, when you've become insulin resistant, each little receptor, each insulin receptor on those cells can sometimes say, no, insulin, you passed by too quickly. You've been here too many times, so I'm not going to let you in. So that sugar just sits in those cells. But when you add some testosterone and when you add different things to help increase your metabolism, you burn that much more quickly, and it works, and it's been very successful so far. So it'll be really fun as more people do this, and as we test these hypotheses and we see it work. But that is how scientifically using hormone replacement can help expedite your weight loss.
And just to chime in on that too, Celeste, what have you experienced with using testosterone in assisting men?
Great benefits. Everybody that I have put on testosterone that's also taking a GLP-1, like William was asking, considering hormone replacement using testosterone to assist with gaining muscle and strength, we've seen great benefits with that. I do like that combination together, and to make sure that we're doing this safely. This is a very safe program. I'm not sure, Dr. Luther, there's about 20 to 25 different laboratory values that we're checking every month on you guys, making sure that, the medication we're giving you and the testosterone and hormones, like Debbie said, we're making sure that that is safe and it's in a controlled environment. So everything is being very thought of and meticulously, accounted for.
Thank you.
And one more thing to add on that too is testosterone likes the muscle. So as Kristianne said, as Marilyn said, as Celeste just said too, when you add that component of the testosterone, you're also feeding those testosterone receptors on your muscle, like in the female pelvic portion of your body too, your and males too, but your bladder is a hollow muscle, your urethra, your everything down there, your uterus, it's a muscle. So when we add that testosterone component too, we support that, and then we get an energy boost and metabolism boost. So it works lovely, just really lovely to help achieve the effects we want, and then too, benefiting too in some women with urinary incontinence. So we could go on and on and on and on about the effects on this particular question, but it really, really, really has improved most of the women that I'm caring for. So,
and I think it goes along with the holistic approach to focus on your metabolic health. Like Celeste said, the amount of lab work that we're checking and monitoring and all of these variables, the three-dimensional body scan to target the fat loss and not the muscle. The hormonal balances all work together, the nutritional, the mobility, and the strength. It's a very comprehensive program ensuring safety, number one, and then success, number two. So
the next question up too is, how do I prevent looking gaunt if I start taking the GLP-1? And that can be kind of funny, because I think we all have known people that all of a sudden they're halfway gone because they've lost so much weight using these medications. However, we don't want that. And I don't believe any patient out there listening wants that gaunt look. So to prevent that, that's where we get into the sometimes with the hormonal support, and then too with this exercise piece. We can't stress that enough, how important that is, because you want the muscle mass. You don't want to lose that. And the mechanism of action for the GLP-1 is to slow down the gastric emptying, to increase your satiety. But as you slow things down, you can slow down mental processes. You can slow down other processes in your body, even the muscle regeneration. So we have to be careful with that. Another reason for the plug of the microdosing, another reason for the plug of the hormones, for the exercise, and most definitely the nutrition. So that is really microdosing, doing it slow, losing the weight slowly, understanding your body and how it works. That's a beautiful way to prevent the gaunt look that none of us want. None of us want that.
Debbie, what is the protocol that we're using for microdosing for women? Where do you start?
Great question. We started at 0.25. It's the lowest dose. You can barely get it in a syringe of the Zepbound.
And a normal dose of Zepbound, the FDA recommended starting dose of Zepbound is 2.5 milligrams per week. So for a lady, we're doing 1/10 of that.
Yes.
And then how about Celeste? What protocol are you using for the men?
Usually for men, I start at 0.5 just because men have a bigger habitus. Not all men, but I'm finding that the 0.5 is a good starting dosage for the men.
So it's about a fifth of the
Mhm.
FDA recommended. Okay.
And to add to that too, then I believe Celeste is practicing this way as well. If you do well the first week and you're managing it well, you have no untoward side effects. Your gut mobility is doing well. You're having regular bowel movements. You're doing things in a normal way, and you're feeling fine, no nausea. Then we move up. But we move up slowly, very slowly. So
That's
Do you
the
have?
correct way.
Yeah.
That's what I do, Debbie.
Do you have to move up?
You don't have to. No, you don't have to. That's another great question. And even statistics are showing that if you can stay at these lower doses, like if you can stay at that 0.25 or that 0.5, if you can stay there, you can do really, really well. But if your hunger begins to overtake you and you feel like the cravings are just they're almost unbearable. Those are clues for us to say, okay, we will go up in another increment. We will go up from 0.25 to 0.5, and then we'll slowly take you up. And then we just converse and make sure that your body and that you're stable. The safety is the most important thing here. But if you can survive and you can get by on the lowest dose of this GLP-1 possible, that's always best. That's always the best way to go.
And Celeste, what do you, say I'm very eager. I want to get this off very quickly. And you're starting me off slowly. I'm losing a pound to 2 pounds. I want to go faster. What's your advice for me?
I would just tell you that's not that's not what we're gonna do. So sorry. I mean, I want to do what's best for you and what's safest for you. So I like to tell patients too, I don't want to completely cut out your desire to eat, because if I do that and I give you too much of the medication and it's working too well, you're not going to eat it all. And that protein that Marilyn was talking, that's so beneficial for us. We're going to see, really bad side effects of that. So I want you to still have an appetite and prioritize the protein, but I don't want to knock out your desire to eat. And at those higher dosages, that's what we are seeing. So, I am the one that prescribes the medication, and so is Debbie. So unfortunately, I have had patients that want to go up, but after discussing this with them and showing them that this is the safest, most effective thing for them, they usually come, they understand, but it just takes some time, But.
All right. What's the next slide, Bree?
Well, helping the GLP-1 help my blood pressure. Well, that's a really loaded question. I love when I get that question because I like working with blood pressure a lot. But the weight loss in and of itself promotes blood pressure reduction. That is just been a consistent since I've been a nurse for all these years. That is just consistent. And when you lose weight, and even losing 10 pounds can reduce your systolic by 2 to 10 millimeters of mercury. So just 10 pounds, you see how much that can bring down that systolic, that working heart rate, that working heart blood pressure, that top number, that's your systolic. When you lose the weight, that starts to come down. So therefore, that relieves the pressure of the blood going through those arteries. That reduces the potential of a heart attack and stroke. And so when you lose weight, and then when you lose 20 pounds, think of that, then you can get your blood pressure, from like the 150 range down to 130. That's a wonderful range to be, and you're not even taking more medication. And then two, this is so important because we've had this happen to some of our patients. Before we started this program, you can lose weight so quickly that you can drop that blood pressure. So that's the beauty of this program too, is that we watch you every week. We monitor these blood pressures. We monitor this to make sure that you're hemodynamically stable as you're taking this, because you don't want to lose this too fast, and you don't want to drop your pressure too fast without having some reductions in potential medication. Most patients I'm seeing want off a lot of these synthetic medications, blood pressure meds being one of them. We can't just take you off of them, but we can help reduce the need for them and help you control your blood pressure through your diet, through your exercise, and through your foods. So yes, yes, yes. Taking a GLP-1, it reduces weight, but reducing that weight reduces your blood pressure. So I love that question. And do I have to attend your classes or can I skip some of the classes? I love that question too because it's loaded. And a lot of people think, well, I have a personal trainer out at this place and I'll use my personal trainer and then I already know what to eat, so I'll use my own mind, my own notes on what to eat, but then I'll come to you just for the injection. That kills the whole process. It's retraining you on how to live and how to manage your weight in the future. That's why all of this program, all of it, the nutrition, seeing Melanie, the stikus, the labs, seeing your health coach, being a part of the fitness, all of this is very important because we monitor all of it. So yes, attending the classes, the exercise classes, build that lean muscle mass. Going to Marilyn introduces you to new ideas of food. You can open up all kinds of opportunities with your kitchen, with food, with eating out, and it becomes fun, and that's what we want. And then when you see us as your health coach, we want to teach you and train you on how to understand the hormone pathways and how to understand the gut mobility and how to understand what your mind is doing. Your brain has so many receptors, hormone receptors on it, and how even the slightest bit of testosterone can come in there and help that. The slightest bit of estrogen can come in and help it, and then help you overall feel better, that you want to exercise, that you want to eat properly, that you feel less brain fog, that you feel like this is really working. So it's truly, truly, truly important to attend the classes, to show up, to be fully engaged in this, because this is truly an investment in your health and in your life. So yeah, it is important. So skipping is not recommended.
And that kind of goes along with a question that just came in. And if you can briefly address this one, Debbie, as far as a patient who's gone through plateaus and stalls on GLP-1s. And obviously, I'm not sure if you're on our program or not. We address those types of issues. And once again, like Kristianne said, we meet every single week. Everybody that you see on here, we meet on Tuesdays for the women and Wednesday or Thursdays for the men. And we go through all these details in a multidisciplinary approach. And we are aware of your goals, your progress. We're looking at your fat loss, muscle retention, labs, all of those things as a team and coming up with suggestions on how to help these things. So when you do plateau and stall, we're addressing that. But the question is, if you have seen that, and then also dealing in perimenopausal women, and you probably have already addressed that to some degree as far as, there again, we'd look at your hormone levels and try to adjust that. But there's so many variables to consider with this. And if you're not in a multidisciplinary program like this, these things easily get overlooked. And I think that was a huge motivation for me to be able to consent to do this. And like I said, it took us 10 months to put this together so that we could cover. And I'm sure there's more things that we haven't covered that we learn and we grow, but we're doing it together. And that's the beauty of it. So, well, thank you all. And then, a common question is, do you have like an example of somebody who's gone through this and can tell us some information about this? And Victoria Blintzer, who's our Vice President of Aesthetics and Wellness at Symbiosis Health, in addition to leading and introducing these programs, actually chose to participate in this one herself. And making not just a part, and she's not just a part of our leadership team, but she's truly one of our success stories. And Vika, will you tell us a little bit about your experience with this? And for those of you that are watching, these are her results in 12 weeks and a measurable change. And this picture here of the circles on there, the outer circle is where she started, and the inner circle is where she ended up. And that constituted a circumferential loss of 5 inches at the waist, 17 pounds. So over 12 weeks, it's right in that sweet zone that we like to target, a pound, no more than 2. But what was very, very impressive, a 26.6% reduction in fat, as well as an 11.1% increase in lean body mass. I know you and Kristianne were getting up early to get that muscle mass on and working out early and making that happen. But Vika, tell us a little bit about your experience.
Absolutely. I love sharing this with anyone who can listen. I just love it. But it hasn't started that way. Last year I went through a hysterectomy and I felt heavy, I felt bloated, I felt uncomfortable. I really wanted to lose the weight, and nothing that I was doing was really moving the needle. I was eating well. I thought I was eating well. I was exercising. I was doing everything right. And when we started talking about introducing these programs, my biggest hesitation was, of course, GLP-1, because I've all the stories that I've heard about the side effects and what people experienced. And I thought I could do it by myself, and I just didn't want to touch it. But at the end of the day, I trusted Dr. Luther and our team, and I decided that I will try it. I will try with microdosing as the program goes. And it's not mandatory with the program. I just chose to try it because this is what we're going to introduce to the public. And I sat down with my health coach. We mapped out a plan that also took into consideration my life and travel plan. So I took a few weeks off here and there, single weeks. But initial hesitation kind of faded when I started going through the program and doing all the things. Marilyn, consultation with Marilyn was truly life-changing and very approachable and easy to follow. And going through the program, when we mapped out my process to see that my initial goal of losing 20 pounds would take me from my start in September to middle week of December. But when I got to a point where I lost 10 pounds somewhere in the middle of the program, my whole philosophy, my whole view just totally changed, because at that point I just felt different. My clothes felt different. It fit different. I felt better. And at that point, kind of that 20 number faded in the distance. And the goal was just to achieve the feeling, just to feel great. Going through everything being monitored with the program, balancing my hormones, nutrition, fitness, just everything being monitored got me to a point was that by the second week of December, I was down 17 pounds. And by Christmas, to go on the cruise with my family for the whole week of Christmas and come back without gaining a single pound. That is true meaning of our program. True goal of our program is not just to lose the weight. You have access to microdosing GLP-1s with no side effects at all to help you get there. But once you get there, to be able to sustain it without gaining a single pound, it's truly life-changing. And now I'm 52. I've don't remember the last time I felt this great. I look this great. I feel wonderful. I feel calm. I feel rested. I sleep better. Everything is just better. And the best part is that my last injection, which never went beyond 1.0, which is still a microdose, it was a month ago. For the past month, I've been completely off the GLP-1s, and my weight has stayed the same. So if any of this speaks to you, I will be happy to sit down and share what we can do for you.
Thank you, Vika. Thank you for being so transparent and vulnerable, and that's great. And that is, we'll show that slide at the end, and we'll get to some questions here and be able to share that. You said you're 52, Vika. Didn't somebody just, one of your good friends, think that they were celebrating your 42nd birthday?
Yes.
Well, a question came in. Is age a factor in success? Can you tell us a little bit about your patients, Celeste, and then Debbie, what the age range is there?
So, Debbie, do you want to start or are you
No,
okay? Okay,
yeah,
okay.
you said.
So, my youngest is 24 and my oldest is 80, going on 81. So, I have a very wide range of ages that I'm now taking care of and helping with this. And I'm seeing both, young and old, great outcomes for, all ages of these men. So, um, testosterone, like Debbie was saying, and the hormonal component of it is such a big game changer for young and old. So if you guys are thinking about doing this program to help with that muscle, um, think about that. I'd love to talk to you guys about that. But it's helping everybody, 20s to 80s. So.
And do you dose things I know we talked about the micro dosing, but have you had to adjust anything based on age that you've observed?
I have. Age, yes, but also not getting enough protein in and hydration. Those are two big things, especially in the elder population, I would say. And like I was saying about taking that dosage and making it a minute compared to the 2.5 start, because that was just cutting people's drive to eat completely out. So other than one patient, I don't have anybody on a higher dosage than the starting dosage. Everybody else is microdosed, and we're seeing a lot of improvement with just keeping on a microdose. People are doing very, very well. So
And how about you, Debbie? What's your age range for the ladies?
Um, range from 40 until my youngest is 40 and oldest is 82.
Okay.
So, and I do have to adjust sometimes for age.
Mhm.
And then too, one thing to consider too is depression as well, because I take care of patients that are struggling with depression, and the GLP-1s too can cause everything to kind of slow down a bit. So we definitely don't want to slow down the serotonin and the different things in the brain. So we watch that as well. So sometimes just backing off a little bit and making sure that we stay mentally that mental acuity is good, and that muscle mass is good. But yeah, anywhere from 40 to about 82 is what I'm seeing.
If used appropriately, these medicines have wonderful, wonderful effects, but we have such an awesome respect for this medicine. We have such a commitment to your holistic care and success and safety that even, at the age of in the 20s or into the 80s, as we're finding, these can have tremendous effects on your metabolic health and overall well-being. And our core focus at Symbios is to live life fully. And if weight or metabolic disease is an obstacle for you to live life fully, it's our passion to do whatever we can to remove this. But we also want to do this in a transformative way. So we are transforming your personal habits in order to enhance your daily living. Symbios means that we're working together. And so this is a relationship. And I'm seeing all these wonderful questions. And I'll be honest with you, I'm looking up some of this stuff because I'm learning and you all bring a lot to the table here. But yeah, so let me see if I can go through those. And William, no, we haven't done the naldolarone. We have not gotten into that. Once again, we're probably more of the team that will focus more on we do bioidentical hormones or synthetic if necessary, and sometimes the absorption of those will determine that. Somebody asked, we don't do compounded medicines. When we really carefully set this up, we research the products very well. Zepbound's a GLP-1 and a GIP. And we found that working directly with Lilly, we can get the vials, and that allows us to microdose those. The pens don't allow that, so we don't do that. Here you go, Marilyn. Do you help with meal planning to guide people in the proper protein consumption?
So we use a really simplified guide, but I will help you through that. And we're working on some meal plans right now. But I don't want to make this like a math problem or complicated. I want it to feel natural how you're eating. But because this is an issue for some people in particular, that's something that we're working on developing into something more specific for people who are having a little bit more of a struggle. And the other thing I would say is too, I usually believe in doing your food, eating your food, but I am using a lot more protein supplements in this population just to make sure we're getting that in. And so I can help you work with that, choose, what might be the optimal protein supplement that would work for you if you're one of those people that might benefit from that.
Yeah, and I think guiding principles, it always seems to work the best if you can learn that. And life
Mhm.
doesn't present to you in a completed plan. Although you can do that. There's a lot of good plans out there, and some people benefit by those. Yeah, so I think that's good too. You talked about fats being important, Marilyn. What fats are important?
So I think that I'm a big advocate of animal proteins, particularly, and I really believe in eating the natural fat in your meats. And really, for most people, if you eat the natural fat in your meat, you're going to be okay. But some people are picking such lean, they're so in that old habit, that old paradigm of limiting fat intake, that can be a problem. But so you can use the good quality, the grass-fed butters. You can use avocado oil, olive oil, these things that you would use for maybe baking or cooking or preparing your food. When you're trying to lose your body fat, you don't necessarily want to add a ton of other fat, but I do want you to eat that natural fat in your meats, and you can use the appropriate kind of fats for your cooking, baking, like the extra virgin olive oil, you can use tallow, those kind of things. We're looking at avocado oil, macadamia oil. So we can talk about what's going to work best for you. So I listen, I ask a lot of questions. I listen to what you're used to doing, what you prefer, and then we kind of work from there as a starting point and what might be either good changes or maybe optimize something you're already doing.
Thank you. And we have time for one more question, Debbie, real briefly. Since this involves working with the pancreas, if cancer of the pancreas is in your family history, is there any evidence of negative side effects for those who have this history?
That's a really great question. And there, there's some evidence that suggests a potential modest increase of acute pancreatitis. Now you have to think too, whenever you're overweight, your pancreas is working hard because it's continually trying to chase that sugar. So the pancreas is getting signals all the time from the brain, release more insulin, release more insulin. That comes from that pancreas. So therefore, the pancreas is inflamed. So the evidence is showing though that and new evidence keeps coming out on this, that the use of the GLP-1 decreases the inflammation because it's helping absorb the glucose, and therefore the pancreas is not having to secrete the instant insulin quite as much. So the research is still coming on that. That's a great question, whoever submitted it. But some studies, I have it right here too, some studies are suggesting that it may even inhibit the growth and metastasis of certain pancreatic cancer cell lines. So I really believe if you can, study the inflammation piece of this, inflammation is the cause of most disease and cancers. So if you can get control of this body inflammation, and that's what this program is designed to do, decrease the inflammation, and therefore help your hormones and your body systems work efficiently. So we can even expound on that. There's a little bit more literature. I won't take the time to read it, but the GLP-1, to sum it up, the GLP-1 is, studies are growing that it actually helps not to exacerbate pancreatic cancer, or even maybe help eliminate it because of the reduction of the inflammation.
Thank you. Well, we are at that 8 o'clock hour, and I want to respect everybody's time. There are still questions that need to be answered. And so our promise to you is that we will answer those, and we'll send those out in a follow-up email in the very near future. But I think the point that we want to communicate is that these can be very, very effective medications. And so many of us struggle with weight. And a study showed that 9 out of 10 people are metabolically unhealthy in this country. This is a large scale study, and it's been presented 3 different ways. And the percentages came out, one at 88%, one at 90, and one at 93. So you can just average that, but 9 out of 10 people will struggle with this in some way. And these products have been very, very effective, but they need to be highly, highly respected. And our passion is to do this in a very holistic, careful, safe way so that your success is ensured and you can substantiate this over a long period of time. And we believe that that involves a multidisciplinary approach. And it's a real pleasure to work with everybody on this team. So if these are some of your obstacles that are inhibiting you from living life fully and enjoying all that God intended for you, you can call Victoria. The number's there on the screen. Her email's there. She's very, very responsive, and we would look forward to working with you on and transforming those personal habits. But thank you very much for your time. Thank you, everybody who presented on the panel, and take care.